Hello, friends, and welcome to the Union Labor Advisory Network. I'm Mike Fina. Today, I'm extremely proud and privileged to have Dr. Edo Paz from Hello Heart with us today to learn a little bit more about his background, history, and experience, and how Hello Heart is supporting the union labor market and their members. So, Edo, thank you so much for joining us today. I appreciate your time. And
Michael, thank you for inviting me.
Oh, my pleasure, man. My pleasure. Thanks, Edo. So, can you tell us a little bit more about your background, your experience in the labor market and how you got started?
Yeah, absolutely. So I'm a physician. I'm board certified in internal medicine and cardiology. I did my training at New York Presbyterian Hospital, Columbia University Medical Center in New York City. And I still practice cardiology at White Plains Hospital, which is a regional hospital here in Westchester. But I've always been very interested in digital health because I think there's a huge opportunity to make an impact. As we'll get into in just a couple minutes now, 80% of cardiovascular disease events would be preventable if we did a better job of managing the risk factors. And I think this is especially true in the union and labor population, where the risk of cardiovascular disease is even higher. So there's a lot of opportunity here, and Hello Heart is one such company that helps us to make an impact on these conditions.
Yeah, I know you brought a couple slides that we'll go over today too, but maybe you could highlight why it's so vital to focus on heart health, especially in the construction trades or just in the labor market in general. And I'll bring that slide up for us.
Yeah, absolutely. So I'm a cardiologist, so I'm a little biased, of course, but if you ask me, heart disease is the number one most important problem affecting Americans. You can see just here on the slides, we're number one in all the wrong places. Number one in prevalence, that means the number of people who have heart and related diseases, the number one killer, and the number one most expensive chronic disease. Just to give you a couple numbers here, when you're thinking about prevalence, if you just think about people with high blood pressure, 48% of adults have high blood pressure alone. That's 120 million people. So these are hugely important problems that are affecting a significant portion of our adult population in America. Now, when you're thinking about the union and labor groups, you can go to the next slide, Michael. But, many of the Taft-Hartley Fund members are actually at increased risk. So, according to the statistics that we have from, the data from the CDC, all of the occupations that you see listed here are at increased risk of heart and cardiovascular diseases. So, plant and machine operators, professional drivers, food and drink preparatory workers, cargo workers. There's also this other aspect of shift work. Anyone who works a night shift or alternating shifts, they're at even higher risk of cardiovascular diseases. So, even for the adult population, it's the number one most important problem. But when thinking about union and labor in particular, it's an even more important problem because there are some additional risk factors in this group of people.
Now, in regards to this too, I know you went through the increased risk. Can you elaborate a little bit more about why you see an increased risk in these particular trades or organizations? I mean, again, the professional drivers, I guess maybe you're stationary more so than others, or first responders, I guess, in regards to just the stress levels.
I think all of the above are true, Michael. Sometimes it's a bit hard to pinpoint exactly why a particular group is at increased risk, but what's clear is the data. According to the data, these groups are absolutely at increased risk. It could have to do with the work itself. Maybe it's lifestyle habits that are related to the type of work that they do. Maybe it's injuries related to the work that they do. The precise reasons are complicated, but the data is very clear that the risk in these groups is significantly higher than others.
Gotcha. And I know we'll have another slide that we'll go to as well in regards to some of the, the technology that's available that you can elaborate on as well.
Yeah. So, as I said in my introduction, I think digital tools are going to be very important for us to address these issues. There's one stat which really sticks out in my mind, and I think it's important for your listeners as well. And that is that 80% of cardiovascular disease events would be preventable if we did a better job managing the risk factors. And, I just told you on the prior slide, there's 120 million people in America with high blood pressure. Only about a quarter of those are well controlled. And that's really disappointing to me as a cardiologist because we understand very well how to treat these problems. We've got a dozen medications for high blood pressure. They're all relatively inexpensive. They're all generics. They've been around for a long time. We understand the lifestyle habits that you need to do to control these risk factors. But even still, we do a very poor job of managing those risk factors. And that's really exposing employees in this field to a significant burden of preventable illness. So, what we do at Hello Heart and the approach we take is that we try to use technology to control heart disease risk factors, help members to take control of their heart risk. So members get a smartphone application and a connected blood pressure cuff, a Bluetooth-enabled blood pressure cuff. And through that, they're able to do a couple of core functions. Number one is the ability to track heart health related metrics. So just tracking your blood pressure, your cholesterol, your medications, your activities, that's really the first step in taking a step to improve your risk. We also do a lot of education. So for example, a blood pressure of 130, is that good or bad? What about an LDL of 130? Providing education to really empower people with these conditions. Whenever you're tracking these heart metrics, you have to have the ability to detect irregularities. So imagine a member has a critically high blood pressure or the monitor detects an irregular heartbeat. We have workflows within the app to help our members understand what do they need to do about it. But I would say one of our core features is our digital coaching. These are tips around diet, exercise, and lifestyle, which I think that in general, people understand the things that they ought to be doing to control their risk factors, but lifestyle change is hard. So the approach we've taken is we've taken these recommendations and made them highly personalized, highly actionable, highly achievable. So rather than tell someone, you should work out 2.5 hours a week next week, for someone who doesn't work out at all, that sounds demotivating. But if I tell you, Michael, why don't you go on a 10-minute walk this afternoon? And next week, why don't you try to do 15-minute walks? That makes it a whole lot more achievable, a whole lot more kind of motivating. There's other things that we do on the app as well. For example, members can generate a report to share with their physicians. Let's say you're tracking all of the blood pressure, cholesterol, medications. We want your doctor to be able to use that information to take care of you in a better way. And we also think a lot about health equity, something that I'll touch on a bit later on this morning.
Yeah, and I can't stress enough too. I believe in as well all these digital applications today to help from a preventative standpoint, from finance to health tech. Just putting yourself, on the right track up front and having some of these tools to help you along the way. Like you mentioned, not saying you got to run 10 miles next week to be able to lose some weight, but that digital coaching to personalize based on the analytics that you have on that person in particular really does help. And I just love to see all these new tools because being preventative obviously is going to drive down those risks, those costs as well, which I'm sure we'll go into a little bit later as well. So
absolutely, Michael, I agree with you 100%.
So I guess on next slide too, what's the cost-effective approach that unions can use to address some of these cardiovascular diseases?
So, you just brought up lots of digital solutions, and I think it's great that there's lots of digital solutions, but I think when union and labor groups are considering these solutions, they need to have a framework for evaluating them to kind of understand what's really effective and what's less effective. So I'm going to walk you through how I think about our effectiveness at Hello Heart, and I think this framework could apply to other solutions as well. First of all, you need to find a solution that has peer-reviewed clinical outcomes. So what you see on the screen here, this is data that we've published in top-tier medical journals, and this is where I spend a lot of my time, is taking a look at the Hello Heart population and describing some of the improvements that we see. So let me walk you through some of the data. So first on the left in red, this is data that we published in the Journal of the American Medical Association. It's a top-tier medical journal, and at the time, it was the largest study of a digital health intervention. We followed almost 30,000 Hello Heart members for a long time, up to 3 years. And what we found was that among members who started with a blood pressure above 140, the average reduction in that group was 21 points. To put that number in perspective, according to the medical literature, so not Hello Heart data, this is based on studies of hundreds of thousands of people. If you can lower someone's blood pressure by 10 points, that would earn you about a 20% reduced risk of having a heart attack or a stroke.
Wow.
So really, really, really important outcome that you see here in the red. On the right half of the slide, we're presenting data from a more recent paper that we published in the Journal of the American Heart Association. Again, it's a top-tier medical journal. It was a big study. We looked at over 100,000 Hello Heart members. And of course, we again looked at blood pressure reduction, but this time we also wanted to look at cholesterol and weight loss. The reason why is that we have a lot of capabilities that are geared toward this. So as an example, for someone with high cholesterol, you can track your cholesterol numbers right within the app. You can get medication reminders to take your cholesterol medications. You can get, lifestyle coaching around diet and exercise habits to improve your cholesterol. So we wanted to see if that translated into improved cholesterol numbers. So the number in green here in the middle is the LDL. That's the bad cholesterol, because elevated LDL is tied to increased risk of heart attack or a stroke. So among people who start with an LDL greater than 160, the average reduction in that group was 67 points. Just like with blood pressure, we know that that kind of improvement is tied with improved outcomes. So again, according to the medical literature, if you could lower your LDL by about 40 points, that's going to reduce your risk of having a heart attack or a stroke also by about 20%. So as a cardiologist, if I meet someone who's at high risk of one of these events, this is exactly what I'm trying to do. I'm trying to pull down those risk factors, control them, multiple risk factors at the same time to really pull down that heart risk. Wow. Now, the last number on the slide, I think, is the most interesting one. We're not a weight loss solution, but we focus on diet, exercise, healthy living. So we wanted to see if members on Hello Heart lost weight. And turns out that they do. So among members who start out with a BMI greater than 30, that's the kind of the clinical definition of obesity, the average weight reduction in that group was 12 pounds, or about 5% of their body weight. So really, really impactful outcomes. And these are the type of outcomes that I think that your listeners should be thinking about when they're considering either Hello Heart or any other digital solution.
Wow. Wow. And now, is this a nationwide, or is this union specific, or is this for the population of Hello Heart users in regards to the blood pressure, cholesterol, and obesity? Is that across the board?
It's a great question. It's across our full book of business, but we do have a lot of clients in the union and labor space, and we're going to highlight one of them a bit later on in this talk, just to be more specific about these, your listeners in particular.
Gotcha. So let's go to the next slide here.
So, clinical outcomes are nice, but financial outcomes are also nice, right? I think it's important to drive clinical outcomes. I think it's those clinical outcomes that are going to drive financial outcomes. But, when your listeners are evaluating a solution, they should look for also clinically validated and, validated financial outcomes as well. So what you see on the slide here is, this is a report that we did with the Validation Institute. They're a third party that looks at your claims analysis and certifies that the conclusion you came to is accurate. And basically, we do these analyses across our book of business. But what we do is we look at for a particular employer, we look at a group of members who enrolled in Hello Heart, and then we find a group of employees at the same employer who did not enroll in Hello Heart. But we match them on baseline characteristics to ensure that we're comparing apples to apples. So for example, we match them on age, on gender, on medical spending. And then we look at the full medical claims in the year before Hello Heart was launched and the year after Hello Heart was launched. The goal being to identify what cost savings, what medical claims reductions did this employer achieve by signing up for Hello Heart. And what we found was about a 19% cost reduction, so reduction in medical claims for the Hello Heart group as compared to the non-Hello Heart group. And the pattern of utilization was really important here. There was a reduction in ER visits, a reduction in hospital days and hospital admissions, a reduction in high-cost imaging. Probably not a surprise, because those three things travel together. If you show up in the emergency room with a critically high blood pressure, you might get a CAT scan of your head and you might be admitted to the hospital. Interestingly, we saw an increase in primary care visits. That's totally by design. So within our app, if let's say you're taking your meds as prescribed and even still your blood pressure is above goal, we're going to say, hey, Michael, it's time for you to go back to your doctor. You might need to have your medications adjusted. So even after accounting for the increase in primary care visits, this report showed a 19% cost savings overall.
Wow. It's again really incredible, just that, having the data and analytics on the individual member and understand where they are from a health wise, because the healthy members, obviously for their families and their lives, but also to work and stay active and productive, it all ties in together. So it's incredible to see that.
Absolutely true. And there's even one other thing I just want to add. This is 1 year cost savings. So what we spoke about earlier, the fact that you might be less likely to see heart attacks and stroke in this population, that's not even what's reflected here. This is just in medical utilization within the first year, they're achieving these cost savings. So I think it's really, really powerful.
Absolutely. Wow. Let's jump to the next slide, Edo, in regards to your approach. Yes.
Yeah, I mean, we think a lot about health equity, and it turns out digital solutions like ours can be very equitable. So first, I'll give you an example of the way we think about health equity. One example of a project we took on was addressing a huge gap when it comes to women's heart health. A woman having a heart attack is twice as likely to die from that heart attack as compared to a man. And it turns out that a lot of that gap is because doctors maybe don't recognize the symptoms, don't treat the patient as aggressively as they would a male colleague. So what we did last year was we developed a feature around heart health and menopause. Women's heart risk goes up significantly around the time of menopause. So societies like the American Heart Association say you should talk to women going through menopause about heart risk. So that's exactly what we did. We designed a feature for women going through menopause. But it's one thing to design a app or a solution that you think it's equitable. It's another thing to actually study your solution and prove that it's equitable. So what you see on the screen here is this is data that we presented 2 years in a row at the American Heart Association meeting and published in their journals, where we looked at all of the different factors on the right side of the slide: age, race, geography, primary language. The app is available in both English and Spanish, income and gender. And we wanted to answer the question were the outcomes equitable? And it turns out the answer is yes, the outcomes were equitable. That means whether you are young or old, you live in a city or in a rural environment, whether your app is in English or Spanish, whether you're a man or a woman, your blood pressure outcomes were exactly the same. So our solution, designed to be equitable, is actually equitable in practice and in our results.
It's great to hear.
Yeah.
And I think our last slide might show, some of the results from a union client in particular, what they would see within the program as well. So let's jump to that slide.
Yeah, so what you're seeing here is outcomes from an electrician union on the East Coast who looked at their medical claims information and identified that heart diseases were at the top of the list. So they signed up for Hello Heart. And then we did one of those cost savings analysis, much like we spoke about earlier with the Validation Institute, where we looked at the actual medical claims for enrollees at this electrician union. And what we found was that the organization saved $1,900, $1,935 within the first year. So looking at that at the whole population level, that's a $1.2 million savings, or about a 2.2 to 1 return on investment. And then on the right side of the screen, you're seeing great blood pressure outcomes, just like we discussed earlier. Among members who started with a blood pressure above 140, the average reduction in that group was around 16 points. So that among that population of stage 2, those people above 140, the highest risk members, 75% of them reduced their heart risk. So it's just another example of a case study where we're seeing both great clinical outcomes as well as really great financial outcomes.
It's great. Just to see the numbers. I mean, the numbers speak for themselves in many ways. And when you look at those statistical data, it just pops out at you right now. And, everything that Hello Heart's doing. I know your affiliation with the American Heart Association as well. Maybe you could share a little bit of information. How do labor unions get in touch with you? How do you work with existing health plans? Do you integrate into the existing plan that labor, Taft-Hartley or public sector funds have today? Or how does that work? If you could explain and elaborate a little bit more.
Yeah, absolutely. So I would say if there's a client or a prospective client who wants to learn more about Hello Heart, they can reach out to me at the contact information that's scrolling here at the bottom of the screen. We have a team focused on union and labor groups that I would connect them with. In terms of contracting, we have we call these easy buttons. We work with a lot of different health plans so that if a union or labor group is getting their health benefits through a particular plan, we can do the contracting directly through the plan, directly with the group itself. So there's a lot of ways that we can do contracting, and the best way would be to reach out to me or one of my colleagues at Hello Heart.
That's great. Well, again, I can't thank you enough for all that you do. I know we see each other at a lot of different conferences. It's like, from one to the next, from Teamsters to labor management conferences to, benefit funds at the IFBBP, but you are there actively supporting union labor, which is phenomenal, and really happy to have you on today to explain and elaborate a little bit more about what you guys have been doing and how you're really supporting labor, reducing those expenses and helping the members as well. So I want to thank you so much for your time today.
No, I want to thank you. And I'll go back to what you just said, which is, it's great to achieve good clinical and financial outcomes, but at the end of the day, we're protecting the actual members of these organizations from preventable illness, And that's a really important thing. 80% of these conditions are preventable if we do a better job of managing our risk factors. And hopefully Hello Heart can help some more of your listeners to achieve those goals.
Yeah, thanks, Edo. And I'm excited to have you on as a sponsor to take a lot of this information, obtain some of those resources and be able to deploy that to the masses. So people do understand, this is, heart health is preventable by you taking these particular, these measures and being proactive as opposed to reactive. And
you're absolutely right. It's way easier to treat someone before he or she has had a heart attack than afterwards.
Without a doubt. Well, thank you so much for your time. We'll have all the information in the context as well and how to reach some of the relationship managers that are supporting your organization as well. So thank you so much for your time, and we look forward to seeing you at some future events.
Thanks for having me on, Michael.
You got it. You got it.
Bye-bye.